Spinal fusion versus disc replacement. One freezes a joint, the other tries to preserve motion. But which one is better? The answer, it depends on the patient and the problem. If you have been told you need surgery for a disc issue, this video will help you understand the real difference between two approaches and which one might be the right choice for you. Hello, I am Dr. Arvind Kulkarni. I am a consultant spine surgeon with a focus on minimally invasive and endoscopic spine surgery. In this video, I'll break down what spinal fusion and disc replacement actually involve, how they compare in terms of outcome, risks and recovery, who qualifies for disc replacement and who doesn't, and how we make the decision based on motion, age, bone health and more. So let's start with basics. What is spinal fusion? Spinal fusion is a surgical technique where two or more vertebrae are permanently welded together, eliminating movement at that particular level. This is done by removing the damaged disc, placing bone graft in a spacer, fixing it in the disc space, holding it together with screws, rods or sometimes plates. Over time, the bones fuse into one solid structure, reducing pain caused by movement, instability, and thus taking care of nerve compression. What are the pros? It is a gold standard. It has proven long-term success. It stabilizes severely degenerated or unstable segments and helps in correcting deformities and instabilities. What are the cons? You lose motion at that particular level. You increase stress on the adjacent level, accelerating degeneration at the adjacent level. It has slightly longer recovery time. Now let's talk about the counterpart, that is disc replacement, which is also called artificial disc replacement or total disc replacement. It's totally the opposite. Here you remove the damaged disc and in the place of the disc you implant a mechanical disc. This allows the joint to move naturally like a healthy disc. The goal is motion preservation, treating pain without freezing the spine. What are its pros? It maintains mobility. It lowers the risk of adjacent level degeneration. It is typically associated with faster recovery than fusion. But it has its cons. Not everyone is a suitable candidate for disc replacement. It's not ideal if you have instability, osteoporosis, deformity, if there are multiple levels involved. It is slightly expensive too. And slight implant wear risk over time is generally an issue. Here's how we decide between fusion and disc replacement. Younger patients may benefit more from motion preservation, that is artificial disc replacement. If the bone quality is poor, it may not support the disc implants where fusion would be an ideal option. If there is a deformity or instability, again fusion may be safer. If it is more than 2 levels, fusion is better. Athletes or physically active patients may prefer disc mobility, and in such cases we would prefer artificial disc replacement. Other conditions such as arthritis, prior surgeries, infections, tumors can also influence the choice, and in most of the time it is fusion that is decided in such conditions. So it's never one is better than the other. It's about choosing the right option for the right problem. Both procedures today can be done using minimally invasive techniques, which means shorter hospital stays, smaller incisions, less blood loss, faster return to activity. Fusion typically requires more protection during healing, as bone takes time to fully fuse, whereas disc replacement allows early movement but may need more imaging follow-up. In both cases, the surgeon's experience and patient selection matter more than the procedure level. So which one is right for you? If you want to preserve motion and if you can meet the selection criteria and have an isolated 1 or 2 level disc degeneration, disc replacement may be the perfect solution. If your spine needs stability, has deformity, if there is multi-level degeneration, fusion may be the only option and it is quite safe and reliable. In either case, the decision must be personalized and not promotional. Please like this video if it helped you understand your surgical options. Please share it with someone considering spine surgery. And subscribe for honest, patient-first guidance from a spine specialist who believes in education before intervention. I'm Dr. Arvind Kulkarni and I see you in the next one.